I'm Dr. Gregory James Hummer. I'm a trained trauma surgeon and the CEO of Simplicity Health Plans. We're in a big mess in the United States today as it pertains to healthcare, in particularly health insurance. And this short series of videos will help you understand how we got to that situation. 4 factors account for 70% of the chronic disease in the United States: high blood pressure, cholesterol, overweight, smoking. 8 out of 10 Americans today are relatively healthy and will spend no more than $700 to $800 in a year, and that includes families, which means the other 2 out of 10 spend most of all the resources that we have available. Currently, our healthcare expenditures are well over $2.2 trillion. This video will consist of 3 main components. The first will be the history of healthcare and how we got into this mess. The second will pertain to how to fix it. And the third will be information about Simplicity Health Plans and how we can offer a solution to the problem. Thank you for watching the videos, and I hope you enjoy them.
The second factor increasing healthcare costs is the advance in medical technologies. Great advances in medical technologies created new and more expensive healthcare opportunities for both providers and patients. With the extraordinary expansion of technology over the past 50 years, discoveries brought new machines, new services that could treat previously untreatable conditions, and new drugs to our nation. Advances such as coronary artery bypass surgeries and joint replacements, advanced new and very expensive surgeries, new drugs like clot busters and beta blockers for blood pressure were introduced to the public and had a profound effect on healing. Medical devices such as newborn ventilators, CT scanners, and implantable defibrillators saved more lives than ever before. And new support systems like electronic medical records and online 24/7 365 contact services improved communications between hospitals, doctors, and patients, which improved medical efficiencies. But all these advances cost more money. Their added cost and value contributed to the escalating costs of healthcare. Sure, our healthcare is better. Yes, we're living longer and healthier, but it all costs more. Along with these great advances in medicine, sophisticated advertising campaigns pulled the American public into spending more money on drugs and elective surgeries. Many of these healthcare expenditures are luxuries and not of necessity. As a result of spending more, our insurance premiums went up to cover our spending. Then, as insurance rates went up, people wanted to get their money's worth out of the high cost of their premiums. When legislation was passed that hospitals could not refuse any emergency room patients, many people, insured and uninsured, started going to emergency rooms for common illnesses that could have been taken care of by a doctor's office visit. Who can blame the real healthcare consumer for wanting to get his money's worth? We spend more, premiums go up. We pay more, so we want to get our money's worth. It's a vicious cycle. In the end, premiums just keep getting higher and higher and higher. The third factor increasing the cost of our health care is the free health care our government gives to the poor, the indigent, and to legal and illegal aliens. Someone has to pay for those services, and it's just not through the tax we pay on our income. Free or low-cost government health care is paid for in 3 ways. First, through your income taxes. Second, through higher prices from your providers. And third, through higher insurance premiums. Some estimates calculate the government as responsible for spending 50 to 60% of all health care expenditures. In a $2.5 trillion market, that's $1.3 to $1.5 trillion a year. The greatest portion of the cost for government subsidies is paid by you, the wage earner, through your income taxes. The second greatest portion of the cost recovery is the hidden tax upon those who can and do pay for their health care. No one speaks about the hidden tax you pay because it is such a big, sensitive issue. Another way of talking about it is to say that providers have to spread the burden. What does that mean? Well, if someone doesn't pay their bill, which is called bad debt, the provider has to spread the burden of its losses amongst those who can pay. When someone can't pay, providers are forced to give free charitable care. The losses for that free care are spread amongst those who can pay. Other times, providers are forced to give health care at significantly reduced prices because of government regulations. For instance, news stories are ripe with the tragedies of hospitals and emergency rooms that have had to close their doors permanently because they cannot charge their paying customers enough money to cover their losses that are a result of government regulations requiring health care for anyone who walks into an emergency room. Free health care even to illegal aliens who pay no taxes. The fact is, providers cannot and will not bear the burden of all those losses alone. They charge you for others' care, and that's the hidden tax we all pay on our health care. For every dollar you spend on health care, a very small percentage of that dollar actually goes towards the service you receive. Without realizing it, and without formalizing it with legislation, we already have a socialized healthcare system. Finally, and this is a double whammy on the healthcare consumer who pays for health insurance, insurance companies have to charge higher premiums to recover the higher price of healthcare due to those who don't or won't pay. We pay higher prices at the provider's office, and we pay higher premiums to the insurance carrier. It's a double hit.
Thank you for watching this segment. Be sure to tune in to the next clip.